Okay, so we're going to talk about how to put in a Foley before you go in and do it. This is a sterile procedure, so the best tips are to be prepared and to have everything you might need. Anticipate anything that could come up. Make sure all of your supplies are there. Once you're sterile, you cannot go back and get anything different unless you want to start totally over. So do a mental check. Make sure you've got the order first for the patient. You're going to gather your supplies to make sure you get a sterile new catheter kit. Make sure it's complete and not just a part of it. You also want to grab anything for pericare, maybe a bed change. If you go into the patient's room and they've soiled their bed, you can't really do a sterile procedure on top of that. So you want to have everything ready. So go into the room. You're going to do some hand hygiene, introduce yourself to the patient. Obviously, double check name, date of birth, assess for any allergies. If the patient has an allergy to latex or to betadine or whatever solution your hospital prefers, then you're going to need to assess that and you're going to need to change your plan, get something else to disinfect with. Then you're going to want to inform the patient what you're going to do. So a lot of patients don't know what a Foley is. They don't know why you have to get it. So it's really important to go over why they're getting it, what's going to happen, what to expect, what they might feel, and then kind of go over the risks associated with it. So let them know that they can get infections, but we are doing all these different measures to prevent that. So that's why we're going to do this big, complex, not complex procedure, but to them it may seem a little excessive. So assess your patient. You want to make sure level of consciousness is good. I guess if it's not, you still have to put one in if that's what the doctor ordered. But just assess them, make sure ABCs are good, and there's nothing else you need to address first before you go putting in a catheter. Let them know they're going to be exposed, especially like older women. Assess your patient that way. Let them know that you will provide privacy. We're going to have the curtain shut, and just go ahead and do it. Shut all the curtains and everything. Get them make sure they're warm, get them a blanket on top of them, and then you're going to expose the lower half of their body. So only expose what you have to. The biggest thing, like I said, is planning. So I like to have my table here next to the bed. That's where I'm going to put my sterile gloves eventually, and then I prefer to put my kit in between the patient's legs at the bottom of the bed. This way, I do not have to look away from my sterile field, because once you look away, then you are no longer sterile. So I like to have everything right there, visible, accessible. That way I don't have to be moving around a lot. So I think we're ready to go. We've assessed the patient. We've assessed for pericare. If they needed it, you would wash your hands, perform all of that, and then wash your hands again before you go ahead with the sterile procedure of putting in the catheter. So pericare is done. Patient's ready for the Foley. We're all exposed. We've got our kit set up. Now you're going to open your sterile catheter kit. You want to be aware that everything inside of the wrapper is sterile. Everything outside of it is not. And that includes the margins of that paper once you unfold it. So make sure you're not crossing your body when you go to unfold it. You want to open the flaps and unfold the one towards you last. So make sure that one is coming last. Then your kit is exposed. You do not have gloves on yet. You're not sterile. You're going to grab the first thing off the top, which is going to be an absorbent pad, absorbent. What I'm looking for? It's not in here. Yeah, your absorbent cloth. So it's sterile. You're going to grab it. Make sure the absorbent side stays down. You're just barely going to grab it with your fingertips and then lay that unsterile side on the bed. Make sure not to touch anything that's sterile. And you're going to kind of tuck that underneath your working area, under the peri area and the legs, just so it can catch anything that may spill. Then you grab the next layer, which is another absorbent pad cloth, and it's going to isolate your working area. So it's going to have a cutout, and whether you're working with a male or a female, you will either put that cutout around the penis or around the entire vagina so that you can see what you're working with and that you can isolate it. Everything else will be covered. You'll have a part that goes up around the pubis and then down between the legs. This needs to stay sterile as well. Do not touch that pad any further than 1 inch around the margins. You cannot touch anywhere else on there. So be aware of that. Now it's time for you to get sterile. So you're going to pull your gloves out. That should be the next thing in your box. And I'm going to set it on my table. That's where I like it. I can unfold the gloves. I can put them on, maintaining sterility. And then you can come and you can work in your box and you're totally sterile. This way, you've got your sterile field open. Your patient is ready to go. And everything is right here in view. So I like to get everything ready. Planning is the key. So I'm going to open the betadine, chlorhexidine, whatever your hospital provides. You may have swabs or you may have cotton balls. Let's say for this video that it's a swab. So you're going to have those open, and then you're also going to get your syringe and balloon ready. So once you put in the catheter, you're going to want to attach the syringe. You need to inflate a balloon at the end of it, and that's going to keep your catheter in place. So get your syringe on there. You're going to inflate it with the entire contents of that syringe. Make sure that bulb at the top is not leaking or malfunctioning in any way. So push it in first, just a little test run. Then you're going to let that water drain back out. Leave the syringe on though. We're just having that prepped and ready to go for once the catheter is inserted. Next, you're going to get your lubricant ready. So when you insert your catheter, it needs to be very lubricated. You may have a little package that you just tear and squeeze the contents into your tray. You may have a syringe, just whatever comes in your kit. Get that lubricant ready. And then if your catheter is already exposed, you're just going to put that right into the lubricant. Have it lubricated, have it sitting there. Get a ton on there. We want it nice and lubricated for this. If it's in like a plastic sheath, then you can leave it if you want to maintain sterility, and you can pull that off before you go ahead and put the catheter in. So all of your contents are ready now. And now we're going to start working on the patient. So you're going to, with your non-dominant hand, go to, let's say if it's a penis, you're going to grab the penis right below the glands. If it's a female, you're going to just open the labia so that you can expose the meatus where you're going to insert your catheter. So you want to open it, let's say it's female. Open the labia. This hand is no longer sterile, so it needs to stay there and cannot touch any of your equipment. This is also why it's good to have your equipment here and close by and ready so you can see it. You don't have to move far. You cannot use this hand anymore. So I will have this open and ready. We need to clean first. You're going to grab one of your swabs. You should have at least 3 and start cleaning cleanest to dirtiest and work your way in. So I'm going to start on the outside labia, and I'm going to swipe from top to bottom, cleanest to dirtiest. Drop that into the trash or into, a waste area, but make sure you do not drop your hand below your waist. You want to make sure that you are maintaining sterility. So get rid of that. Grab your second one, clean the other labia, get rid of that. Grab your third one, go straight down the middle. So this entire area should be clean now. Get rid of that swab. Keep this hand here, and now your patient is clean. She's ready for the catheter to be inserted. Just go ahead and grab your catheter with sterile hand, and you're going to insert it into the meatus. And this might be complicated on a female. Hopefully you visualized where it is before you went in for this, so you need to really check. And then go ahead and insert. You want to keep inserting until you see urine come out. If you can get that whole thing in there and there's no urine, you're probably in the vagina and you need to just leave it and go get a new tray. So it's going to be easier to put in a catheter if you've messed up already. You want to leave that one in so you don't put it in the same spot and keep putting it into the vagina versus the meatus where it needs to go. So we're going to say we got it right on the first try. You're going to keep advancing the catheter. Make sure you don't accidentally touch any part of the labia, the meatus, or anything as you're inserting. Be really careful of that because you want to keep this hand sterile as you're inserting this into the body. So keep pushing it in. You see yellow urine, perfect. Advance it about another inch or two, and then you're going to inflate your balloon. So push the whole contents of the fluid in. Now your catheter is all the way in there. You can, while this is expressed, this is my syringe with the fluid, use your other hand to tug on it, and you want it to catch. So the goal is that balloon is inflated inside of the bladder. You've advanced it a little bit too far, which was what we wanted. So it should pull out a little bit and then catch on that balloon. And that's how we know we've inserted successfully. So our balloon catches, and then you're going to use your left hand and your right hand to come together, untwist your syringe, just get rid of that, and now you're done. We need to attach this Foley, so you're going to probably tear off your barrier, that cloth that we put on that had isolated the area. Tear it off, get it out of the way, maybe clean your patient up. You've got betadine everywhere, maybe lubricant, so use an extra towel. You should have brought this with you to wipe her down, him or her down. Then you're going to attach the Foley tubing with like a stat lock or a Y, onto the leg. And then you want to set up your Foley, so make sure you attach it to the bedside. There's no kinks or curls or anything. The patient isn't laying on it because you don't want anything obstructing that flow. So that is your Foley.